Health, Adrian Aoun from Forward, and Erin Bali from Carbon Health, as well as your moderator, Daryl Etherington.
All right, thanks for joining me, everyone. We got Toyin, Erin, and Adrian. Great to have you. Great group to talk about this topic, democratizing healthcare. I think there's one thing that the pandemic has done many things, obviously, to society and the world at large, but it has also thrown into sharp relief kind of the problems with accessibility around healthcare, especially in the US. And I'd love to have a chat here today with all of you about how tech companies and startups can go about addressing those problems and hopefully kind of narrowing the divide for access to care. I would love to, I think let's kick it off, Toyin. I just want to get your thoughts on, what have you seen out of the pandemic? What has this changed about your approach, if anything, and for City Block Health, and what has it meant for you over there?
Sure. So maybe just some context as I answer the question. City Block Health is a primary care, behavioral health, and social care provider that's focused on the most marginalized communities, specifically people who receive their care through Medicaid or who receive Medicare and Medicaid services. These are folks for whom access to care services, even before the pandemic, was really challenged. Folks who struggle with social barriers to getting into the doctor's office, who struggle to be heard and respected and treated with dignity when they get to the doctor's office, who struggle with follow-up and care coordination. And what the pandemic showed us was just how important a couple things were. First, the importance of not conflating physical infrastructure with access to care. We knew before even the pandemic, from listening to the members whom we serve, that showing up and meeting people really where they are, including in their homes, in the community, virtually, was critical to ensuring that they actually had access to services. And so relying just on bricks and mortar as the single modality was not going to work for them. The pandemic reinforced that and showed us that it was ubiquitous across our ecosystem. And then I think the second main lesson has been more structural. It's been the notion that when crisis hits, folks who are least empowered, folks who are most marginalized, are often the folks who struggle the most. And we saw that through the disproportionate impact of the pandemic on communities of color, on essential workers, on low-income individuals, exactly the people whom we serve at City Block. And so those inequities get multiplied when there is a crisis. And we were really fortunate as an organization, because of the way we get funded, because of our business model that's oriented around value-based care, that we were actually in a position to pivot and to shift and to reinvest in making sure we were meeting our members where they needed to be met, despite the pandemic, in a way that a lot of community-based providers weren't. And so the idea that you can actually create systems that are resilient to inequities, systems that can actually invest to support people who need it the most through a value-based approach to healthcare was also a really important lesson for us through the pandemic.
Great. So I think, you bring up some interesting things that I think are common across everyone's business here. And one of those is the focus on the actual consumer of healthcare, right? The patient and the individual receiving the care. So is that now actually front and center? Is that something that people now care about more than before? I know, Adrian, I know you have thoughts on this, but Adrian, Erin, you want to jump in?
Erin, go for it.
Sure. So I think just quick background, we started Carbon Health because we want to be able to provide a really differentiated healthcare that's accessible to the majority of the population. In a way, I'm an immigrant. I came from Turkey, and I was surprised by, one, how good the diagnostics and therapeutics and all the technology was in the United States. But it was only accessible to really, honestly, top 5-10% of the country. The healthcare that an average person, average retail employee, 40-year-old working at Home Depot, the healthcare that they receive is way worse than most European countries.
Right.
That was a huge surprise for me. And so we kind of from day one said, okay, what is the best healthcare we can provide to a person who's neither super affluent nor super kind of high risk in a way that kind of qualifies them for government reimbursement, right? So just the average person who has an insurance, probably get poorly insured. So we kind of really start from that perspective of that person and really design everything around that, right? So I think these three companies you have probably are majority of the extremely consumer-centric healthcare providers in the country. Like probably in this room, maybe
Right.
more, right? So you have most of this, but essentially, I think the new breed of companies are always going to be like obsessively consumer-centric, especially as the payment models become more democratized.
Right.
Yeah, so maybe I'll take a slightly different kind of view on this, right? So we keep saying that these companies are kind of consumer centric, but in many ways, like I think one of the things that you realize is that when you get in bed with the kind of with the insurance companies, which we see that, you know, like whether it's a Carbon or a City Block at the end of the day, you get in bed with the insurance companies, unfortunately, like your incentive is basically not to kind of go build a good consumer product, right? And so like, I'll kind of use, I'll kind of, if Aaron will permit me, I'll kind of pick on him for a second. So early on, Carbon did something really interesting, right? Carbon, we have at Forward, folks, so we have kind of this pretty cool smart screen that we put in the exam room. It's great. It's a nice way for you to kind of like visualize your body, see all your data, see everything that's kind of going on with you and your doctor and discuss it. Early on, Carbon copied us, right? They put a smart screen in the exam room for you and your doctor to kind of look over your results. I thought that was absolutely awesome. And I was really, really happy that Aaron did that. But I don't see that screen anymore in any of your locations. Now ask yourself why? Well, it's because there is no billing code for spending more time with your members. There is no billing code for helping them understand, and there is no billing code for making them healthier, right? So when you kind of take a step back, unfortunately, like I'm sure you have hundreds of engineers now, Aaron, and you know, unfortunately what they're doing is they're basically working on how to help bill you faster. Whereas I have 100 engineers working on, you know, preventing heart disease, preventing cancer, right? And so like the problem here is when you get in bed at the end of the day with the insurers, your incentives are actually not the right thing. They're not to kind of do what the consumer needs. So at the end of the day, like you're launching a scheduling feature, we're launching a heart health program that eliminates kind of high blood pressure in 40% of our members. You're launching a new way to bill me, I'm launching cancer prevention. So I think one of the key things that we really, if you truly believe in this notion of like, we should build products for the consumer and we should try and actually kind of democratize healthcare, then the first thing you need to start asking yourself is, why are we in bed with the insurers? Because that's not the end customer, that's not the consumer. And I think that's the conversation we should be having.
Well, I think I want to give Aaron a chance to respond here, but I think typical of, I mean, and also Toya, because
That's
But
not,
ready to
like,
go.
because maybe I'll just, can I just slip right in there?
No,
Because I
go
think
for it.
the
Go for it.
binary
I don't
you're
wanna-
painting here, Adrian, is that it's either you get reimbursed by insurance or you build a consumer or patient-centered company. And you know, in parentheses, that only very wealthy people can afford. What we found is actually that's not the binary. Like there's another path, which is partner with insurers, but take risk on the total cost of care and outcomes. And so we do not bill for a community health worker coming to your home, holding your hand, telling you that you matter, and helping understand what goes on for your life. But we absolutely are incentivized to do that and to innovate in that space, because that allows us to earn the right to provide healthcare to people that make them healthier. And so the flip side is, I think, you know, there's an approach that says, let's go all for the consumer experience and let's cut out the insurer and let's just have pure incentives around delighting our customer. But the reality is, I've never not once seen a product that is built for that cohort trickle down to serving marginalized people.
Okay, so
I was going to say something. Wait, Adrian, we got to give Aaron a chance to rebut as well before. I was going to say exactly the same thing Toya was going to say too, because that struck me as that's all well and good, but like you're addressing the top of the market. But Aaron, go ahead.
I love the more confronting panel stuff. You guys should always do that. Look, here's the reality, right? So there are maybe 50 million people at, like, if you are being generous, that would be applicable for a concierge healthcare offering. Like they can pay out of pocket, because like most people are covered by some sort of insurance, even though they're poorly insured, they don't have the means to access, like spend thousands of dollars every year from their kind of basic primary care, right? And look, there's also high risk Medicare dual eligible class, like where you can take risk. I mean, that's maybe another 20, 40 million people, right? So, I mean, you can call like 60 million if you want to be generous there. Reality is like there are $300 million people, or neither too sick, so sick that the government is going to pay a premium for their care, even if you are taking risks, nor they are so rich that they can pay out of pocket. So it's, at the end of the day, like design comes from constraints, right? The constraint, and everybody, look, like all these companies are great companies. We all started from different constraints, right? For Adrian's constraint was, he said, I want to build the best healthcare that money can buy. Okay, and that actually is a fun thing to do, right? So you can, no budget constraint, or kind of serving people who make $500,000 or more, just like Silicon Valley, like VCs, and that kind of, that's again, like there's a lot of interesting stuff they do. And I also sometimes feel jealous because I wish I did not have any budget constraints, right? Versus the design constraint we took as, let's just pick a reasonable amount of cost. And what we picked is, we said roughly what Medicare pays just fee for service, like plus minus 10, 20%, that's a reasonable amount of cost. We said, instead of saying like, what's the best healthcare that money can buy, we said, what is the best healthcare that can fit into this cost structure? Okay, so now it's more about making the providers more efficiency. So instead of kind of like building more like kind of, I don't know, like gimmicky fancy stuff for like widgets and toys for patients, we are focusing on how do you make providers more efficient? How do you remove more and more of the low value tests they are doing so they can actually help more patients? Because what we have learned is when everything is equal, providers really want to see more patients. They want to be able to serve more like lower income, like middle of the road patients. So essentially we've kind of had to invest more on like stuff they work on. And actually it also had to work in the existing system, right? So I cannot tell a Home Depot employee that like, I mean, they're like, you don't know how happy somebody who's making $40,000 to have healthcare insurance. Right. That's actually one of the most game-changing things. If you just say, I'm not going to accept your insurance, you have to pay extra to me, like that's just a no-go from the beginning. So it's really, I think, like the innovation comes from what constraints you are picking. So we put a very hard cost constraint before we started anything else.
Okay, so I think that's all a great narrative, but let's look at the reality, okay? So when you get in bed with your with these insurers, I think the world starts to look a little different than the story you're painting. I went and I looked at Aaron's prices. So a year ago, your virtual visits cost $49. Now they cost $69. A year ago, your gynecology appointment cost $75. Now it costs $195. And a year ago, your normal everyday visit, as you call it, costs $149. Now it costs $195. On average, your prices have doubled in under 18 months. See, that's the thing with insurance companies, right? I always say they believe in the law of more premiums, more out-of-pocket costs, more profits for them. I'm an engineer. I prefer Moore's law over the law of more technology, more value, and more health. So I'll tell you what, the way I think about it is we're going to drive our cost to zero, right? We're going to use technology and we're going to continue to drive our cost to zero. Our cost to serve a member today is 26% of what it was 18 months ago. Yours is 226%. So I'll tell you what, I'll make you a deal, Aaron. I'll wire you $1 million today if you pledge to never take insurance again.
Yeah, I'll let Toy this up. If the world changes and insurance goes away and most people don't need it, we'll happily stop taking it. Right? We don't like dealing with insurance companies, but I think it's the reality. It is the reality, right? So
I think it is the reality. I also think that Adrian, I really don't get the sense still that you've addressed that the driving the cost to zero is actually there. Like, aren't there fixed hard costs that you run up against? And also that seems great for in the future, but it doesn't address the path there, and it doesn't address all the humans today. Yes, exactly. Healthcare. And waiting for a trickle down is like that to Toyan's point has never proven to come true previously. Those people are hurting right now, right? So what's the address?
So let's address point. Let me address kind of both points. I'll start with Toyan's and then I'll start with yours, Daryl. So Toyan, I think you paint a really good narrative, but let's kind of pull the numbers, right? So you mentioned earlier when we were chatting before this that CityBlock is headquartered in New York. So New York spent last year about $12,000 on average per Medicare patient. So look, I totally get why you're in the business. This is like, frankly, it's a really good business to make a lot of money. But let's not sit here and pretend like this is the scalable solution for all of America, right? Now, it's actually worse than that because people are on Medicaid for roughly 9 months at a time on average. So at some point you realize, like, why are we even talking about this? Like, you believe you're going to have like massive health outcomes in 9 months? Like, that's not how you prevent issues. This is how we like rescue them in the last minute, right? We have to start getting ahead of them. So then you start asking, okay, what does the world look like if we truly want to change healthcare? And Aaron said it himself. You were very kind. You said, look, I'm jealous. I'm jealous of the world that you want to build. I'm jealous of Ford. Okay, awesome. You're very kind. So we agree that we want a better world.
Oh, you said that exactly. That's a mischaracterization.
I'll take it anyway. So we agree that we want a better world. So now let's talk about how to get there. So my argument, my posit is that we need to rebuild the entire healthcare system from the ground up. Like, you name it, it's time to redo it. Literally, from open heart surgery to delivering babies to oncology. Now, you have to start asking yourself, like, what does that look like? Now, when Elon talks about a carbon-free world, we know that he's at the beginning, right? He needs infrastructure, he needs cheaper cars, he needs time. When we talk about an insurance-free world, we need the exact same three, right? We need infrastructure, we need cheaper care, and we need time. Now, when you think of infrastructure, I want you to think of things like body scanners and sensors. When you think of cheaper care, I want you to think of things like AI and algorithms. When you think of time, it's time to build out an entirely brand new healthcare system built right for me, not the insurance companies, and built once and for all. Now, these paradigm shifts take time. I think Toyin's incredibly right on that, right? But you look at this, like, whatever, they called the first iPhone a walled garden. It didn't work with your digital camera. It didn't work with, you couldn't install apps. You couldn't even watch movies. 15 years later, the entire world has been rebuilt on top of iOS. Now, the way to think about it is everyone else in healthcare is playing checkers. They're proud they built a doctor's office with an app. But I think it's time we start playing chess. I think it's time that we actually start doing it right and building the foundational infrastructure that will bring about the healthcare of tomorrow.
Well, yeah, Toyin, please. I was going to call on you because I think that, yeah, I want to hear what you're
sitting on my hands. And, I appreciate how you're approaching this. However, I think you're picking the insurer as it's a little bit of a red herring here. I think the fundamental question is, what are we trying to solve for? And you may vision yourself the Elon Musk of healthcare. I vision myself a human who is trying to make the world better today for people who are sick and suffering, who do not have access to the types of sort of technology and tools and systems that we may aspire to for the future. Specifically, people for whom the vast majority of their health outcomes, the factors that drive whether they will live or die, whether they will live to see their grandchildren, actually have nothing to do with your body scanners, have everything to do with, do they have enough food to eat? Do they have transportation to get to that doctor's office? Did they experience like profound trauma in their lives every day? What do they have access to green, nutritious foods to eat? Those types of factors, as we know, are major drivers of health outcomes, particularly for lower income individuals. And so we can start by building the doctor's office of the future that is personalized to you, your body, your biome, your internal organs. But if we don't recognize that there is an ecosystem in which people live and exist that has to be changed today, and that there are actual tools in our payment structures today that we can leverage to make a difference for these people, we're doing them and ourselves a disservice. And I don't think that's transformation. I truly don't. I think saying, look, actually, flawed as they are, and none of us are going to say that insurance is not flawed as it is, we have a payment mechanism today that is operating in effect as a market failure. We've not leveraged and deployed the resources that we have today into the places that we can actually drive the maximum impact from. There's an opportunity to say, and I'm not talking about the iPhone here. I'm talking about how do I make the world better today for people? We can take the tools and the flawed systems that we have and make so much better out of them. And in so doing, have, I think, a vast, vast impact on others. And maybe those curves converge one day. And maybe we find ourselves in a world in which your technology in the future can be applied to the types of members I serve today. And that would be a beautiful thing. And I certainly think that there are many ways to skin a cat. And we need a lot of different types of innovation in this ecosystem, but there is no silver bullet. There is no equivalent of the Tesla battery to transform us today from the systems that we have into the place that we want to be in the future. And so I think that there is something about the sort of concreteness or the binariness with which I think you're thinking about this world that just doesn't resonate with my reality. There's room for all of us. There has to be room for all of us. I happen to believe that the path we're taking that is saying, how do we bring the best possible care to people who have the least resources today and watch those resources transform their lives, is a really worthy and worthwhile path. I think that the path that Carbon is taking around saying, how do we, within the constraints of the pocketbooks of people who are making too much to qualify for Medicaid, but too little to walk into your fancy clinics, that is a worthwhile and noble path to build into, because we can do better for them today as well. And so I think that there's a path for our conversation that looks like saying, how do these things play together as opposed to tearing them down? I don't think that you're going to win that argument.
I think the polemic is misplaced here. I mean, it's maybe rhetorically interesting, but it's not real. It's like, you bring up the Elon comparison, like that is it's an interesting comparison to choose because of all the very valid criticisms about that particular individual that exist out there. But like, he doesn't, if we had a bunch of people just run off and say, you know, I'm going to move up, we're all as billionaires are going to focus on moving human life off space to Mars, like nothing would work. All other infrastructure would break down, right? So if you're an Elon, Adrian, you need people who are managing the issues that are real and that are present in people's lives currently. Aaron, I interrupted. You go ahead, say something.
No, look, honestly, even if you take the like fun Elon kind of analogy, right? So like, look, I think there's a world where you can just say, I'm going to move life on Earth and go to Mars. And there are a lot of investors who like that mission and dream, right? So like a ton of people will kind of like want to invest in kind of mission to Mars, even though we know, I mean, it's going to happen at one point. Like we just don't know whether it's going to happen in our lifetime. But there's also the mission of saying, I'm going to make rockets a little bit cheaper. I'm going to make it so that they're reusable, so I don't have to spend as much money, right? And then eventually, just a step by step, go to Mars eventually one day. But I guess like I kind of honestly like this teardown format because most conferences like so I want to take Adrian for it. But to me, like the Adrian's bet is that he's going to use AI to make the super expensive healthcare today a lot cheaper over time. Right, so that's his bet, and if it happens, that's just great for the whole world, right? So versus in our case, like we decided to start from affordable, and Adrian is I think confusing our price in different cities. Like we are objectively affordable. We are in bottom 30% of all providers in our service lines. Like there's an as objective as you can get in affordability rate, right? So our take was let's just start from an affordable angle and let's just make this better and better every day, because like I don't believe you can replace physicians with AI in our lifetimes. I honestly, my most popular tweet was saying, I believe investors will be replaced by AI far than doctors. It's a lot.
Hard agree.
It's really complex. They look at like there's a lot of vision. They look at how you tell this guy. It's not just like a data processing thing. What investors do, like they look at their metrics and decide on a number to invest. That will be AI way before doctors are replaced. So our take was like, and since doctors will be still in the game, there's a hard cost with them. There's a hard cost with infrastructure. So it's actually this idea that you can use technology to take it to zero. Like, look, maybe it's right. Like that's Adrian's bet. It's worth investing in that bet. Our bet was the opposite, which is it costs what it costs. If anything, in healthcare is becoming more expensive because the scarce resources become more and more expensive over time, right? It's just you need to improve on the efficiency. Whether you use insurance reimbursement or even if people pay it out of pocket, just doesn't really matter. Like you just need to be able to provide care to a person in a format that's as efficient as humanly possible if you want to reduce the total cost of care.
The healthcare in the United States over the last 50 years has gone from 6% of GDP to just shy of 20% of GDP. The reason I'm beating up on insurance and anybody who kind of works with insurance is because you guys are literally taking a 20% pay cut of every single person in this country. And frankly, I want my money back. So Toyin, you can sit here and say, hey, I'm helping people. But frankly, I don't know. Maybe if we just took our $12,000 of taxes and handed it to those people, it might be better. Now, we keep coming and saying Ford is super expensive, but Ford is literally cheaper than most deductibles. It's literally cheaper to buy Ford than to use your own health insurance. Let's just take California. So the cheapest ACA plan in San Francisco is from Kaiser or Oscar. It's about $430 a month and has a $7,000 deductible. So let's be real. You probably can't afford it. And if you can't afford it, you probably can't afford to use it. Ford has no copays, no upsells, no extra for blood tests, no surprise bills. Ford's cheaper than literally your first 10 minutes at Carbon, right? Like I can give it to you in an easier way. The average cell phone plan in the United States is $125. There's about 325 million Americans, and somehow there's literally about 340 million cell phone plans. So what are we quibbling about? Literally, we're the price of a cell phone bill, right? But the idea is really simple. Our price is going to go down, and your guys' price is going to go up, because that's what insurance does. And I think that's what needs to stop. I think if we truly say we want healthcare to be democratized and we want healthcare to be affordable, we need to stop paying a 20% tax in the entire country.
Here,
Yeah, so-
we're almost out of time, so I want to make sure both of you have a time to retort. So Aaron, you go first, and then Toyin, you'll finish this up.
You're conflating different numbers to kind of make get the audience to confuse about numbers. Look, average person's healthcare costs around, in your age demographic, it costs around $500, give or take. And your cost is $2,000, you're like 4 times more expensive. Right? If the entire country switched to forward today, that 20% would be like 30%, right? So the thing is, like, if you look at it objectively, you cannot talk about the total reimbursement rate, because at the end of the day, we all do primary care, which is a small percentage of overall healthcare costs. So you can't just look at total healthcare costs of an insurance and compare with like a primary care cost of another company. So it's just apples to apples. Like it is, look, as I said, like I have a lot of rich friends, like I'm happy for them to get really premium care, but it's just not, it's not going to be mainstream applicable. It's definitely not cheaper objectively. Like it's just the fact that suggestion that's cheaper already is just like, that's ridiculous.
Well, about 40% of our members are uninsured. Just to give you the, we keep saying, like, I don't know, we have billionaires signing up for it. If so, let me know who they are. But about 40% of our members are uninsured. So at some point you start asking yourself, like, why are they signing up, right? And what you quickly realize is, like, they don't have time to wait for you guys to kind of go build the system. They're already jumping into the new world saying, like, hey, we need this. Now, yes, you're completely right. Like, we have not built the entire system, which is why we're working as fast as we can. And we're not just primary care. We've now launched things in dermatology. We've launched things in mental health. We've launched things in cardiology. We've launched things in weight loss. And we're going to keep going until, yes, one day we've rebuilt the entire healthcare system.
Toyin, go ahead.
I'm going to use my last 30 seconds not to center Adrian and his work anymore.
You got 3 minutes. You can
I'm really over it, to be honest. I think it's like there's something like deeply, deeply problematic to me about you and the way that you're framing your vision for the world that like explicitly chooses to ignore the totality of people's lived experiences and the factors that drive the 10% of the population for whom the type of care you provide is never going to address their needs and their outcomes. And so I think focusing in on the intent of this conversation, as I understood it, which is to ask about where are the different places in which we can, by building intentionally for our users and our consumers, drive better outcomes for them in a way that is sustainable and scalable and potentially is a model for others to replicate. And I'll go, I continue to believe that there's room for many, many different approaches to this at the table. But one essential feature factor here is the recognition that healthcare outcomes are more than just what happens in an exam room, what you see on a scan, what you do on a blood test, the focus of precision medicine and personalized care on the notion that people have all of their other needs met, such that the tools that we apply towards them can have maximum impact. That is not true. It may be in a utopic world where we have universal basic income and we no longer provide people with, we no longer spend as much as we do on healthcare reactively as we do in prevention and creating healthy communities, but that is not the world we live in today. And in today's world, understanding that the people whom I care for need more than fancy scans and a sort of superficial attempt at changing their experience, and they need to be listened to and heard. They need to be dignified and respected. They need tools that are built for their needs, that are anchored in their communities, and they need an experience of care that does way more than slowly starts to chip away at the other parts of the ecosystem. We bring emergency rooms to people's homes. We send paramedics and EMTs into their homes to evaluate them for acute needs, to treat them and solve their issues in real time. We bring people food if they're hungry. We support them in getting housed. We provide mental health treatment as needed on demand. And we drive outcomes. And we drive outcomes in a way that starts to create a model for how we might reinvest our healthcare dollars, which I agree with you there, Adrian, that like we should be thinking about how we spend our dollars and what's the way to spend them in areas that drive better outcomes over time as opposed to reactively when people get sick. I would like to see us pull those dollars out of the acute care system, out of the hospitals, and invest in communities that are healthier. But the way to start, I continue to contend, is not by building what the 1% or the 5% needs and waiting for decades for that to trickle down. There is something here about understanding your customer. And so if you really believe that your technology is going to solve the problems of my members today, like start opening free clinics and testing, asking them what they need. Start like actually talking to our members and start like showing us for once that this theory you have about trickle down value actually exists in our ecosystem, because we have not seen it. And so I start where I intend to have impact.
We're just about out of time.
People who I intend to impact and build from there.
Thank you very much, Toya. I have to cut everyone off, but I'm going to use my editorial authority here to also say you should all get a universal healthcare system like we have in Canada and just put reasonable rates of taxation to the wealthy individuals and redistribute it for social good. So that's the end of the healthcare panel.
Thank you.
You don't get to retort to that. So thanks very much.
Bye-bye.